Hey, good afternoon. My name is Sean. Thanks so much for joining me to talk about our bodies. Today, I want to talk to you about chronic pain and back spasm, what to do and what to think. So, first of all, let's get comfortable. You're probably watching this because you're not feeling good. So, if you can put your back on a flat surface and your hips and legs at a right angle, it's going to naturally take the weight off of your spine. You do want to make sure that your object, furniture, whatever, is just under your knee height. So I've taken this block and I've added two blankets to it to make it just the right height for me. And that's important because if your knees are pushing that way, they're going to pull on your back, and if they're forward pressing on you, it's going to press your back down. At a perfect right angle, there's no outside pressure on your spine. It can just relax with its own tension. That by itself can be incredibly valuable for somebody in chronic pain or having a bad back spasm. So, what is pain? I talk to tons of people about pain. Most people are trying to avoid their pain, cover their pain, hide their pain. Your pain is happening for a reason. Your body is attempting to let you know through your nervous system that there is an issue that needs to be addressed. And anything that just takes your pain away isn't addressing your issue. It's just covering it up temporarily. Damage is still occurring, inflammation is still building up, injury is still happening. So you have to figure out where the root cause of that is. For many people, it's a muscular dysfunction, it's a muscle not working the right way, holding you in a bad position. So if you're having pain, especially an ongoing pain in a specific part of your body, try and understand, ask yourself, what is really going on here? And then you can start to look for solutions. If you can take responsibility for your own pain, you're going to have a much, much better chance of returning to a normal life. So, for those of you watching, you're probably in chronic pain or having a back spasm right now. If you're in a back spasm, it can be really intense. It can be unbearable. It really just takes your life away. You can't walk. I've had periods in my life where I threw my low back out kind of frequently, and periods in my life where I threw my neck out frequently. And I haven't thrown my low back out in 4 or 5 years, and it's been since last Christmas that I had a neck problem because I'm managing my posture, the health of my muscles, and my mobility. So, how do you do that? How do you break into your pain syndrome and change it? Well, for most of you, especially those of you in back spasm, there's a muscle on your spine that has done something it shouldn't, and your body is stiffening up to protect your spine, albeit quite painfully. So what you need to do is avoid resting in twisted positions. Even if it's not immediately comfortable, you want to try and rest in an even, neutral position as often as possible. If your body is twisted up and contorted, it's going to have a much harder time healing and feeling better, and it needs to be given a reason to relax. In the same way that whatever your issue is caused it to tighten up and respond that way, you need to give it a new stimulus that's going to reset it. So like with our legs up here, we're not putting any additional tension on our back. So if there's a spasm in your back or a tight area, it's going to rest into itself until it lets go, because it doesn't have to hold on to anything right now in this position. So it's a really good way to reset. Standing flat against a wall is also a really good way to reset. Maybe not for someone having a huge spasm at this moment. There's a couple other things you can do to be comfortable. So when I work with people that are having a bad back spasm right now, what I have them do is either lay with their legs up or flat on the ground. If you put a strap around your legs and just rest your legs into it, it's going to help your pelvis find a more neutral position more quickly. There have been plenty of times where I helped someone in back spasm over the phone without even looking at them, and that's how sure I can be that these things will help your body. So, exercise number one you can do, you just set your feet flat on the ground, hands out, palms up, and you just press gently on the strap and relax. And so there's a good likelihood if you're in chronic pain or back spasm that your hips aren't working together. When you press within a strap that does not stretch, you're forcing your hips to work together automatically. They're naturally going to find a balance so that they stay lined up with you as they create force. If you can add big toe pressure, that's going to make it even more effective, putting tension through your ankle. If you do this gently for a few minutes, it should help your back calm down a lot. Another thing you can do, and a big reason that people get back spasms and chronic lower back pain, is because their glutes aren't working properly. So if you lay flat on the ground with your toes out to the side, maybe let your back relax for a couple minutes, and then just squeeze your butt real gently. Now, if you feel your back tighten up, you can only squeeze your butt a tiny bit. You really need your back to stay absolutely relaxed when you're doing that little butt squeeze. You could put a hand on your stomach and under your back, and you're just going to work through it slowly. You might spend 5 or 10 minutes doing this if you're having a bad back spasm, and you're just going to squeeze your glutes and relax. And the more you do it, the more independent they should become until your back can stay totally relaxed, and you're probably going to have a lot of relief. Now, you may not be ready to go work out today or do anything really exciting, but you should feel better. And by continuing to do these exercises, you're going to restore your health, your alignment, and you're also going to protect yourself from having these instances in the future. Just the other week, a colleague of mine called me. His employee was having a back spasm at the airport. I spoke to him on the phone for 10 minutes. We used his belt and his carry-on to do a couple little exercises, and he felt 60% better right away. Checked with him a couple of days later. He's fine. He's still doing his exercises. Hopefully that won't ever happen again for him. Super duper simple. Yeah. One more that you can do is taking a pillow and pressing it gently between your knees. Real gentle, big toe pressure. This works on your hip flexor. Your hip flexor attaches to your entire lower back from the inside of your body and goes through your pelvis into your leg bone, your femur. If your hip flexors are uneven in their tension and function, it can put a lot of pressure on your lumbar trying to navigate that difference. It can also pull on it. It's just not good to have bad hip flexors for your low back. So by squeezing this gently, just like with the strap, you're forcing your hip flexors to work together. And you just do that gently for a while, and they should start to be more responsive to you and function a little bit better. When your parts aren't responding to your movement properly, that's when you start to have issues. If you can restore your basic functions, your basic position, your body will have a much better opportunity to heal. It's a big, big difference. It's helped tons of people. Really passionate about it. Hope this helps you. Leave a comment with any questions. Shoot me an email. Go to my website. I'm here for you. I want to help y'all. Have a great day. Thanks so much for watching. Good luck.